Here's the thing. The questions I get from non-doctors with rheumatoid arthritis are very different than the questions I get from patients who are also doctors. Why is that? Years and years of training and taking care of all kinds of different medical conditions teaches us a thing or two about what's important and what's not. The questions doctors ask aren't necessarily better, but they may offer you a different perspective and give you more information than you would have previously even thought to ask about. These are the 5 questions doctors with RA ask. I think you'll find them helpful and hopefully will give you some insight that you can use to make the best health decisions for you and your life. So stick around. How did you make this diagnosis and how certain are you? This is not a question we often think we can ask, but when it comes to RA and really any other autoimmune condition, it's an important one. Rheumatoid arthritis is diagnosed using a set of criteria that include your symptoms, what we see when we do a physical exam, and your blood work and x-rays or MRI results. Sometimes the diagnosis is a slam dunk, but other times not so much. I want to tell you about a patient I had named Dr. Jones. Obviously, I changed the name. He was a physician in his late 60s, getting close to retirement. He had had hand pain and swelling for years that he self-managed with daily NSAIDs. Years. Doctors are notoriously bad at taking care of themselves. But anyways, he finally had his Nourish drops and blood work, and he had a positive rheumatoid factor and CCP antibody. And if you don't know what those are, I'll link the videos in the description box below. Anyways, so with those 2 positive tests, he comes to see me. Yes, he had positive blood work, but on close inspection, the results were only barely positive, so it was far from a slam dunk, and his hands looked like the hands of someone with osteoarthritis. Because he had osteoarthritis of his hands, it wasn't easy for me to tell if he had joint synovial swelling, which is really the hallmark of rheumatoid arthritis. His x-rays were not particularly helpful either. So all in all, he had a mildly positive blood work, maybe some joint swelling, and he had joint pain that was bad enough to warrant a daily or sometimes twice daily NSAID for years. With all this information, I made a diagnosis of rheumatoid arthritis, and when he asked how certain I was honest. Not 100%. How was it helpful for him to know that I had doubts? Well, it opened up the conversation into what he could pay attention to in his day-to-day life that could help fill the information gap. How stiff were his hands in the morning? What exactly did he feel if he didn't take his daily NSAID? Was it wrist pain, finger pain? And if so, where in the finger? It also led to us discussing what other conditions I was considering, and in his case, it was OA. Finding out your doctor may not be 100% certain about your diagnosis may not sound like a good thing because, of course, we want answers. But asking this question can open the door to many more insightful conversations that can get you closer to answers and to feeling better. What is the treatment strategy? Notice the question isn't asking how do you treat this or what is the medication you recommend, but more a broad strategy question. A strategy implies that you have a goal and that there will be steps to get you to that goal. Doctors think to ask this because this is what we do all day, every day. It's my job to have plan B, plan C, plan D at the ready should plan A not work out. I have those plans ready because I know what I'm working towards. So what is the goal when treating rheumatoid arthritis? Well, these days we push to remission. Remission in the scientific literature has an actual definition, but suffice to say, for you, remission means you have little to no joint pain or swelling, your inflammatory blood test markers are normal, and you aren't needing regular NSAIDs or prednisone. Goals are not static. They can sometimes change as we get to know your flavor of RA better or as your health status changes. But the point is, there is a goal, and you and your doctor should know what it is and be on the same page. With Dr. Jones, we decided our goal was to get him on less NSAIDs. Let me clarify, actually. That was my goal, which he begrudgingly agreed to because he honestly didn't think it was possible. But at least we had the conversation and we both knew where we stood. How will we know if this strategy is working? In RA, we follow two inflammatory markers, the SED rate or ESR and the C-reactive protein or CRP. These are blood tests that tend to go up and down with RA inflammation. But I'm going to add a bonus question here that hardly no one asks, and that's whether you're a doctor or not, and that is, what can I follow at home to tell me if it's working? This is key because so many people come into my office stressed and nervous because they think everything hinges on the blood work. So what can you follow at home in between appointments? Joint pain and stiffness, but also pay attention to your morning. How stiff do you feel in your body when you wake up? How easy or not so easy is it to get up and go? How often do you find yourself reaching for that anti-inflammatory pain medicine? In the case of Dr. Jones, despite being a doctor himself, we spent quite a bit of time discussing how he could start to pay attention to his joint pain and what it might be telling him. Remember, this was a man who had powered through for years before finally seeing me, so it wasn't natural for him to pay attention to his pain. And that's okay. This is actually quite common. Paying attention can take time and practice, but it's worth looking into and talking to your doctor about. What medication side effects do you usually see interfere with most people's lives? Docs know that medications have side effects. There's just no getting around that. But what they usually want to know are which side effects are the ones I've actually seen in real life and not just in a drug insert, and two, which ones I've seen actually interfere with people's lives. Some will even take it a step further and specifically ask about something that's particularly important to them and make sure the medication we're talking about won't interfere with it. So again, for example, my dear Dr. Jones specifically brought up his love for all things wine. He enjoyed wine tasting and over the years had built up a whole social life that brought him a lot of joy around wine. So anything that would interfere with that was off the table as far as he was concerned. I appreciated him bringing this up and opening up the conversation because had I not known that, I would have told him that methotrexate was the go-to initial medication we use. And doing that, I would have risked either he'd take the medication and then suffer from liver inflammation, as it's recommended that you abstain from alcohol when you're on methotrexate, or take the prescription but never actually take the medication, which is bad for our relationship and most importantly for his arthritis. We could find an alternative because he asked specifically how a medication was going to interact with a priority in his life. What can I be doing in my life to help my condition or help the medications work? I know with our short visits it can seem like your rheumatologist doesn't have many thoughts about lifestyle changes you can make that will impact your RA. We spend the majority of our short visits reviewing lab results and discussing medications, but there are things that can help, and for the most part, we love talking about them. So here's just a short list of some of the initial lifestyle changes you can take and discuss more with your doctor. So stop smoking. Everyone, all the time, always. Also, in rheumatoid arthritis, smoking has been found to decrease the effectiveness of medication. Wear SPF, especially while taking hydroxychloroquine or Plaquenil, as the medication can make you more sensitive to the sun. Pay attention to your diet and how certain foods affect your joint pain and stiffness. Sugar, red meat, and ultra-processed foods are notorious triggers. And then, of course, there's stress. Stress can play a huge role in our autoimmune condition, and rheumatoid arthritis is no exception. In Dr. Jones' case, talking about this gave him more insight into some of the choices he was making and how they may be affecting his health. More specifically, it was a decision he wasn't making that was affecting him as he was delaying even thinking about retirement. No decision was made overnight, of course, but the conversations we had in clinic got the wheels turning, and he eventually decided to hang up his white coat, a decision, of course, that brought its own set of stressors. But ultimately, it led to a more balanced and less stress and less painful life. You don't need to ask all these questions in one visit. When you get a new diagnosis of RA, it can feel like you are trying to drink from a fire hose, but I recommend mulling them over and keeping them in your back pocket. I know I brought up a lot of different topics during this video, including the autoantibodies we use in rheumatoid arthritis, like the rheumatoid factor and the CCP. We also talked about the idea that both rheumatoid and osteoarthritis can affect the hand and cause hand pain. If you want to know anything more about those topics, I'm going to put links to videos in the description box. Okay, thanks. Oh, and please subscribe, and we'll see you next time. Bye-bye.